Here with the latest news on COVID from GMA3, what you need to know. Please welcome back ABC News Chief Medical Correspondent, Dr. Jennifer Ashton. Good to have you back.
Looking good.
Thank you, my friend.
So let's start with this week's news on the Pfizer COVID-19 vaccine for children under 5.
So
what do we need to know?
pediatricians, parents waiting for the FDA to possibly grant emergency use authorization for this age group under 5, starting 6 months and up. Pfizer has submitted data for 2-dose regimen, but here comes the but. They have already said they're testing a 3rd dose because they didn't get good antibody levels in children of this age with just 2 doses, but they wanted to submit the data they had. They expect the 3rd dose data by March and April. So if emergency use authorization is given by the FDA later this month, the children of that age could start to get the series, but remember, very likely a 3rd dose will be needed.
It's got to be so hard for parents with small children. I keep saying it. I'm like so
That's
grateful
right.
that my children are grown right, especially right now.
Yeah.
What can parents do when they have a small child who has COVID and they can't isolate them?
Well, I mean, first of all, to be clear, the most important thing that parents can do is to vaccinate everyone who is eligible, who will be around those younger children, that so-called buffer of protection. The silver lining, if there is one, is that the rate of severe illness in very young children and babies is very, very low, less than a risk of 1.5% of needing hospitalization. But you guys, I know someone who just had a baby over the weekend and the baby has COVID. No symptoms, no symptoms, thankfully, but it's very stressful.
And of course, you can't explain it to babies and kids.
Some people will get it in a household and others won't.
That's
and
right.
You go, how is that possible?
Yeah, happened to me.
Right,
That's
exactly.
Right. That's right.
So why have so many people died from COVID? I mean, I know that different variants
this one's
have
less
different
severe in
results.
It's less severe, so you're asking the question on so many people's mind, which is if we're hearing Omicron less severe, why are we still seeing death rates over 2,000? And again, we expect that, unfortunately, to continue even as the cases start to go down because of that lag time. And the 2 big reasons are pre-existing medical conditions, which unfortunately affect a numerous amount of our population, and the unvaccinated. Remember that it's not only the unvaccinated who are dying of COVID right now, but it is the majority. So those 2 things together are a bad combination.
And is there any new news in terms of treatments for COVID now or in the future?
Yes, and we always like the bright light in this never-ending pandemic. Paxlovid, which is a pill designed for people who are not admitted to the hospital, got authorization. It's 5 days of pills. You should take it within 5 days of developing symptoms. It is free, but it is hard to find, although the United States has more supply of it than any other country in the world. So that's going to be a resource for people.
And that shortens the duration or the severity?
And it lowers the risk of requiring hospitalization by almost 90%.
Oh, wow.
So that would be for someone who is high risk of developing complications, someone who's older with pre-existing medical conditions. It is not a substitute for vaccination.
Right.
And then the other news, Ryan, is monoclonal antibodies. Now the FDA dialing back that authorization, saying it's not so effective for Omicron and it can have some side effects, so we shouldn't be just randomly giving that to people.
Really?
Yeah.
What are the side effects?
So some shortness of breath, some GI distress. So I think this is just a reminder, as you said, we're 2 years in, but we're continuing to learn about this virus, treatment, some high-risk groups, and it seems like there is no shortage of
We can't wait to have you
headlines.
back for a segment where we talk about aches and pains and longevity or something, you know? It's like something other than COVID. I miss those segments.
Yes.
Can't we do a fun strep throat segment?
Yeah, wouldn't that'd be a highlight in these times?
Yes.
Be sure to check out Dr. Jennifer Ashton's show, GMA3, What You Need to Know, weekdays on ABC. Great to see you. Thank you.